which form these circuits. Blood travels throughout the body in a closed system of tubes which vary in function and size depending on their location. Large arteries carry blood away from the heart. These arteries branch into smaller arteries and eventually arterioles, which supply capillary beds that are found in organs and tissues throughout the body. The blood from capillaries drains into venules, which join to form larger veins that return blood to the heart. All of the vessels which conduct blood from the right ventricle of the heart to the lungs and back to the left atrium constitute the pulmonary circuit. The transportation of blood from the left ventricle to body organs and tissues and its return to the right atrium occurs within vessels of the systemic circuit. The blood vessels which connect the heart and lungs and form the pulmonary circuit can be identified in this anterior view of the thorax of our specimen. The pulmonary trunk is the large vessel which transports deoxygenated blood away from the right ventricle. The trunk branches into the left and right pulmonary arteries. The left pulmonary artery is shorter and enters the left lung immediately. The right pulmonary artery is longer and courses posterior to the aorta and superior vena cava before it reaches the right lung. The lungs are where gaseous exchange of carbon dioxide and oxygen occurs between the blood and air. In the fetus, blood does not enter the underdeveloped lungs through the pulmonary vessels, but is shunted instead from the pulmonary trunk to the aorta through the ductus arteriosus. The ligamentum arteriosum is the fibrous remnant in the adult of the fetal ductus arteriosus. Two pulmonary veins return oxygenated blood from each lung to the left atrium. When the pulmonary trunk and left pulmonary artery are retracted, we can see the two left pulmonary veins as they exit from the lung. We will now demonstrate many of the major arteries and veins of the systemic circuit which carry blood away from the left ventricle and then return it to the right atrium. In general, arteries are relatively deep in position and are protected by surrounding bones and muscles. Frequently, their names are based on their location or the structure which they supply, and they are usually accompanied by one or more deep veins that have similar names. By contrast, veins referred to as superficial are located nearer the surface of the body. There are many interconnections between the superficial and deep veins. In this specimen, the major tributaries of the superior vena cava, the brachiocephalic veins, have been removed so that we can examine the three portions of the aorta and some of their branches. The proximal portion, the ascending aorta, has two branches, the left and right coronary arteries, which supply the heart wall. The coronary arteries arise very close to the exit of the aorta from the left ventricle and cannot be seen in this specimen. The middle portion, the arch of the aorta, has three major branches which furnish blood to the head, neck, and upper limbs. The most proximal branch from the arch is the brachiocephalic trunk. It further divides into the right subclavian artery, which carries blood toward the right upper limb, and the right common carotid artery, which supplies the head and neck regions on the right side. Arterial blood to the left side of the head and neck regions is transported by the middle branch of the arch, the left common carotid artery. The third branch of the arch, the left subclavian artery, conveys blood toward the left upper limb. The distal portion of the aorta is the descending aorta. It travels behind the heart in the thorax as the thoracic aorta, and then continues into the abdomen as the abdominal aorta. The common carotid artery and its major branches can be seen in this illustration of the arteries of the right side of the head and neck. As previously shown on our specimen, the origins of the right and left common carotid arteries are different, but their courses through the neck region are the same. Each common carotid artery ascends in the neck without branching until it reaches the superior border of the larynx, where it divides into its two major branches, the external and internal carotid arteries. Some of the branches of the external carotid artery in the neck include the superior thyroid, lingual, facial, and occipital arteries, which supply the thyroid gland, tongue, and skin and muscles of the anterior face and posterior scalp. The external carotid artery divides into two terminal branches, the maxillary and superficial temporal arteries. The maxillary artery supplies many structures of the deep face and head, including the ear, dura mater, upper and lower jaws and chewing muscles, teeth, and nasal and oral cavities. The superficial temporal artery remains more superficial in its travels as it ascends on the lateral side of the head to furnish arterial blood to the skin and muscles of the scalp. The other major division of the common carotid artery, the internal carotid artery, continues to ascend in the neck without branching and enters the skull through the carotid canal to supply blood to the brain and orbit. Another pair of vessels which distribute blood to the brain are the vertebral arteries. The course of one of these arteries is also shown in this illustration. The vertebral artery, which is a direct branch of the subclavian artery in the neck region, travels superiorly through the neck within the transverse foramina of the cervical vertebrae and enters the skull through the foramen magnum. Using this illustration of the undersurface of the brain, we will follow the courses of the vertebral and internal carotid arteries as they form a vascular network which provides arterial blood to the brain. Part of the cerebellum and the temporal lobe of the cerebrum have been removed on the right side to show the pathway of several of the vessels. After the vertebral arteries have entered the skull, they join at the inferior border of the pons to form the basilar artery. Before they unite, the vertebral arteries give off branches to the spinal cord and the cerebellum. The basilar artery lies on the anterior surface of the pons and provides blood to the pons, cerebellum, and inner ear. It divides near the junction of the pons and midbrain into paired posterior cerebral arteries, which distribute blood to the occipital and inferior temporal lobes of the cerebrum. The other pair of arteries which furnish blood to the brain are the internal carotid arteries. Each artery divides into its terminal branches, the middle and anterior cerebral arteries. The larger middle cerebral arteries are the direct continuations of the internal carotid arteries and travel laterally to supply the temporal and parietal lobes of the cerebrum. The smaller anterior cerebral arteries course medially and distribute arterial blood to the medial surfaces of both cerebral hemispheres. The anterior communicating artery is an arterial shunt which connects the two anterior cerebral arteries. The posterior communicating arteries, which join the middle cerebral arteries and the posterior cerebral arteries, are also important arterial shunts because they connect the brain's anterior and posterior blood supply. These three communicating vessels complete the formation of an arterial anastomosis called the circle of Willis. This arterial circle is very important in ensuring adequate blood flow to the brain by providing an alternate pathway for blood to travel when one of the major arteries supplying the brain is blocked. Using our specimen, we will now identify many of the vessels and their branches we have described. The structures of the brain which can be used as landmarks include the cerebellum, medulla oblongata, pons, midbrain, optic chiasma, and the temporal lobes and frontal lobes of the cerebrum. The vertebral arteries are two of the arteries which transport blood to the brain. Contributions from the vertebral arteries form the anterior spinal artery, which supplies the spinal cord. Also arising from the vertebral arteries are the posterior inferior cerebellar arteries, which furnish blood to the inferior cerebellum. Near the junction of the pons and medulla, the vertebral arteries unite to form the basilar artery. Some of the branches of the basilar artery which can be identified in this specimen include the anterior inferior cerebellar arteries, also supplying the inferior cerebellum, and several small pontine branches going to the pons. The superior cerebellar arteries furnish blood to the superior part of the cerebellum. The basilar artery terminates by dividing into the two posterior cerebral arteries. The internal carotid arteries and their branches can also be reviewed in this specimen. The middle cerebral arteries are the continuations of the internal carotid arteries which travel to the temporal and parietal lobes. The other branches, the anterior cerebral arteries, can be traced in their courses toward the medial surfaces of the frontal lobes. These two vessels are connected by the small, delicate anterior communicating artery. The posterior communicating arteries, which join the middle cerebral and posterior cerebral arteries, complete the formation of the circle of Willis. In this specimen, we will trace the pattern of arterial flow in the upper limb and identify some of the veins which accompany the arteries. As previously described, the left subclavian artery, a direct branch of the arch of the aorta, and the right subclavian artery, a branch of the brachiocephalic trunk, carry blood toward the upper limbs. On the right side of our specimen, the clavicle has been cut and the muscles of the neck and axilla have been reflected to permit viewing of the vessels and nerves in the region. Near the clavicle and the first rib, the subclavian artery becomes the axillary artery. Located near the axillary artery is the brachial plexus of nerves, which furnishes sensory and motor innervation to the shoulder and upper limb. When the nerves of the plexus are retracted, we can see the axillary artery more clearly. Its branches supply muscles and other structures in the thorax and shoulder regions. Lying near the artery is the large axillary vein. It transports blood from the upper limb to the subclavian veins. When the axillary artery exits the axillary region, it continues as the brachial artery. It supplies muscles and other structures in the arm as it travels toward the elbow. The brachial artery is accompanied by two brachial veins, which are major tributaries of the axillary vein. Also seen in this region are two superficial veins of the upper limb, which carry blood from the hand, forearm, and arm to the axillary vein. The basilic vein lies medial in position, and the cephalic vein lies on the lateral side of the upper limb. After the brachial artery crosses the elbow, it divides into the radial artery and the ulnar artery. These arteries are named for the bones they follow, and each artery generally has two veins with similar names that accompany the artery through the forearm. The radial artery is the smaller of the two arteries and supplies structures on the lateral side of the forearm. Near the wrist, it travels deep and is the major contributor to the formation of the deep palmar arterial arch in the hand. The larger ulnar artery travels more medially in position as it courses through the forearm. When it crosses the wrist, the ulnar artery remains superficial in position and continues into the hand to form the superficial palmar arterial arch. The palmar digital branches from the superficial arch travel toward the digits to furnish oxygenated blood to the fingers. The continuation of the aortic arch, as previously described, is the descending aorta. The thoracic portion of the descending aorta travels behind the heart in the thorax. It continues to descend and passes through the diaphragm to become the abdominal aorta. The many branches of the aorta furnish arterial blood to the internal viscera in both the thorax and the abdomen, and they are generally named for the structures they supply. In this specimen, the great vessels have been cut and the heart and lungs have been removed so that we can more easily see the anatomy of the deep thorax. Some of the structures which can be identified in this view are the superior vena cava, brachiocephalic veins, ascending aorta, trachea, primary bronchi, esophagus, vertebral column, and ribs. When the esophagus is reflected laterally, the thoracic aorta and several of the posterior intercostal arteries become more visible. These vessels supply the structures of the posterior intercostal spaces and the deep back, including the muscles, vertebrae, and spinal cord. The azygos vein is also very deep in position in the thorax and lies near the vertebral column. It receives venous drainage from the right ascending lumbar vein, which drains the right abdominal cavity wall, and the right posterior intercostal veins, which drain the chest wall. The azygos vein empties into the superior vena cava and is part of a bypass route of venous drainage from the lower limbs. The major vessels of the abdominal and pelvic regions are arterial branches of the aorta and tributaries of the inferior vena cava. In this view, the aorta is on the left side of our specimen, and the inferior vena cava lies on the right. Although the abdominal viscera have been removed in this specimen, the proximal ends of the vessels arising from the aorta which supply the viscera are present and can be identified. The first branches from the aorta that are given off immediately after it enters the abdomen are the paired inferior phrenic arteries. The right inferior phrenic artery can be traced to the undersurface of the diaphragm which it supplies.
Interesting, but we didn't do that one.
The unpaired large celiac trunk has 3 branches which furnish blood to the liver, gallbladder, stomach, spleen, pancreas, and duodenum. These branches are the common hepatic artery, the left gastric artery, and the splenic artery. The unpaired superior mesenteric artery originates from the aorta just inferior to the celiac trunk. This vessel delivers blood to the small intestine and to the proximal half of the large intestine. Not seen in this specimen are the paired suprarenal arteries to the suprarenal glands, but one of the paired renal arteries, which convey blood to the kidneys, can be seen on the right side in this dissection. 4 pairs of lumbar arteries arising from the aorta supply the posterior abdominal walls. 2 of these arteries on the right side can be seen in this specimen.
We didn't do those.
The paired gonadal arteries arise below the origin of the renal arteries from the aorta. They travel inferiorly to the testes in the male as the testicular arteries, and to the ovaries and uterine tubes in the female as the ovarian arteries. Another unpaired aortic branch is the inferior mesenteric artery. It furnishes arterial blood to the distal half of the large intestine, the portion not supplied by the superior mesenteric artery. The aorta divides at about the level of the 4th lumbar vertebra into the common iliac arteries. The unpaired median sacral artery arises at this bifurcation and supplies the sacrum and coccyx. Each common iliac artery continues to descend and further divides into an internal iliac artery, which furnishes oxygenated blood to the viscera and walls of the pelvic cavity, and the external iliac artery, which travels into the lower limb and becomes the femoral artery. The veins which drain the abdominopelvic walls and some of its viscera empty into the inferior vena cava and are generally named similarly to the arteries they accompany. The internal iliac vein and the external iliac vein on each side merge to form the common iliac vein. The paired common iliac veins empty into the inferior vena cava at about the level of the fifth lumbar vertebra. Important tributaries of the inferior vena cava as it ascends through the abdominal cavity toward the heart include the lumbar veins, right gonadal vein, renal veins, right suprarenal vein, hepatic veins, and inferior phrenic veins.